specific story or example of how this leadership program has influenced me has been just the opportunities to get to know scholars around the country and other places that wouldn't have the opportunity otherwise in my own program. So one story would be when I remember collaborating with folks on like role playing a scenario for a policy problem, and this was at the Milken Institute of Public Health. And so I remember being in the room with not like I'm a sociologist, but I was also in the room with folks doing health policy and also like studying mosquitoes. And so it was pretty cool to see how we all came together to sort of form a solution using our disciplines. My understanding of leadership has changed since being part of HPRS by, for this program, it has taught me that it's not great to work in silos. Like we emphasize cross collaboration, cross sectoral collaboration, and I feel like this program really brought that to heart for me, because in leadership, I've always been taught about delegation or being the strongest in your discipline. But HPRS really took that to another level and taught us about servant leadership and being in service of others for leading for health equity. And so that's how my understanding has been changed in leadership. It's not just about me, it's about the team, it's about growing together and working towards health equity. And so I'm using these leadership concepts in the work I do by connecting folks across sectors. Right? I collaborate with the Cal Poly Center for Health Research on a number of projects, including one that's in Santa Barbara County called Mi Gente Nuestra Salud. And we work with researchers as well as community members, campesinas, students, practitioners, and county officials and elected officials in the city to really understand what are the health needs of our communities and how can we best address them. And the leadership concepts from this training program has given me the opportunity to practice those skills in my community by bringing these leaders together to develop solutions that increase the health and well-being of our communities. The advice that I would give someone entering the HPRS program is to really go out of your comfort zone to get to know other scholars and other disciplines. I've had a wonderful time getting to know my cohort mates and even collaborating across disciplines, being able to publish a paper together with one of my cohort mates and learn more about similar interests that we have and how we can put that to work to advance how we feel about health equity and shape the field for others doing this work. So definitely step out of doing your own thing and lean on your cohort mates. My vision for a culture of health is a community that has access to all the resources that are available to them for having and leading a healthy life. Not only that, but also working together with other folks in improving communities. A culture of health is not achieved by one person or by one program. A culture of health is achieved by bringing the community together to ensure healthy living. The HPRS training complemented my doctoral program because at UC Santa Barbara, there was no medical sociology program. There's no sociology of health resources. And so my interest was in, and is in health equity and social movements. And I feel like the HPRS training really complemented that because I was able to learn from scholars across race, ethnicity, immigration, and gender sexuality studies and sociology while also learning a really robust and thoughtful curricula on health policy, health equity, epidemiology, political science, you name it. Like, there were a lot of interdisciplinary emphasis in the beginning of my training. And I feel like that really complemented it because I was not getting that in my program. And so I'm really thankful for HPRS for being so generous in the intellectual community they're building, as well as the lessons that they are teaching scholars. My participation in HPRS helped me to achieve my goals by emphasizing leadership, and also all of these cool tools and workshops and people that we get to meet and hear from, really inspiring a vision for a leadership structure that looks different than what we were raised in. Never in my life did I think that I was going to be leading health equity initiatives in my communities, or researching the health needs and assets of communities that are near and dear to my heart, until I joined HPRS. HPRS really gave me the confidence and the tools to be an effective leader in the world that we're currently living in, and also the strength to stick to my values and value myself when other people don't. So I'm really grateful for HPRS for helping me to achieve those goals in that way.